is with great pleasure and honor to present Ridgefield's debate for the 26th State Senatorial District and the 111th State House District with Tony Boucher and John Hartwell, and John Fry and Joseph Heyman. I would also like to thank the Playhouse for hosting our debate, our wonderful volunteers from question screeners, greeters, setup and breakdown to our timers. I would like to do a special thank you to Marilyn Carroll and Kitty Fisher, our voter service chairs, for doing such a wonderful job of putting the debate together. And of course, a special thank you to our candidates and our senator and our House rep. Now I would like to introduce our moderator for the evening, Jean Rabineau. She is a 20-plus year league member with extensive experience in moderating debates all across the state. She is a member of the steering committee of the League of Women Voters of the Bridgeport area, where she served as membership chair, secretary, vice president, and president. She is the administrator for the League of Women Voters Connecticut and the League of Women Voters Connecticut Education Fund, has served as an election moderator in Trumbull for more than 12 years, and is an attorney in private practice with the firm of McMillan and Rabineau in Trumbull. As a volunteer, she serves on the board of the Friends of the Trumbull Library and is a member and former managing director of the Trumbull Historical Society. She has been certified by Special Olympics Connecticut as a bowling coach and coaches Trumbull Special Olympics bowling and swim teams. She was born in Washington, D.C., raised in Maryland, attended college in Illinois and law school in New Haven, and has lived in Trumbull for the last 32 years. Please help me in welcoming our moderator for the evening, Jean Rabineau.
Thank you. Before we go over the rules of the debate, I have one request. If you've got a pager or cell phone, turn it off now, please, because this is being taped and you would be amazed at how well that picks up on the tape and drowns out the questions and answers. Many of you have seen debates in Ridgefield before. You know that we have a very interesting format. Each candidate will be given 2 minutes to answer each question. And when all the candidates have answered a particular question, they are each given 30 seconds to rebut. However, each candidate also has a bank of time that he or she can go into at will. So if the candidate feels that an answer or a rebuttal needs a little bit more time, they can extend until their 10-minute time bank has been used up. At that point, when the timer's watch goes off, time is called. We have tossed for order of response and also later for the order of close. So the first question, and I'm going to start on the Senate side, we'll go to Mr. Hartwell first, then to Ms. Boucher, then we'll switch to the other side where it will go to Mr. Heyman and then Mr. Fry. And the first question is from the League. Connecticut is facing the prospect of unprecedented budget deficits. What specific steps would you take to increase state revenues? What cuts in state spending would you recommend?
Well, thank you very much, Tim, for this. To the League of Ridgefield, I want to thank you very much for having this evening. I've been a League member.
The microphone, please.
Sorry?
That's okay.
I'm sorry. I just want people to know that I am a League member myself and then can join the League of Women Voters. I didn't change the name, but to change the rules. My mother was a League member all of her life, and it's a terrific organization, so I appreciate the opportunity to be here. We have a $3.3 billion gap that's coming up in the next budget. And there are really only three options available for what we want to do. We can either cut spending, raise revenues, or borrow some more money. None of these things are optimal, and all of them, in fact, are painful. So the first thing I want to say is that we're all in this together. We're a community, and we need to take a fresh look at what we do in government. We have to have an honest conversation about how much government we want and how we're going to pay for it. And I think that that's a conversation that we have to have together. We need to do things differently in state government, and the choice here is clear. I've spent my life in business as a consultant solving problems, and I look at things differently, and I come to solutions. I help people solve their problems and come to new ideas. And what I'm not is a politician. I haven't been in the state legislature, so I can come at this with a fresh point of view. There are things that we can do to save money. We can reorganize the government. We can increase efficiency. For example, there's a commission out there that met last year. It's called the Commission on Enhancing Agency Outcomes, a horrible name for it. They said that there was, for example, $900 million on the table if we simply reversed the use of long-term nursing care and did more nursing in your home. So that's one idea that we would have for decreasing the cost of government. There are many more.
Thank you. As Connecticut is a part-time legislature, and it's called a citizen legislature, many of us have real-world jobs. And in my real-world job, I travel all over the country, Canada and Puerto Rico, visiting various large businesses and small ones and helping them manage their financial resources. So I know what's going on in the rest of the world. It gives you an advantage, especially since I know a chief economist. And it gives you an advantage to be able to bring that real-world experience, and I have done that in my first 2 years in the Senate, that you were trusting enough to vote me in 2008. As a member of the Finance Committee, where the taxing occurs, we were able to prevent a few extra taxes to be had, because in closing this deficit, instead of addressing the biggest problem the state has, which is the size of its state government, the cost of state government, which has increased, by the way, 149% since 1991 when we enacted the state income tax. They've literally kicked the can down the road and doing the responsible things. But you wanted some real details. What we need to do to close that deficit is to enforce the constitutional spending cap, which has not been enforced. We need to reduce or eliminate $185 million in scheduled salary increases to state employees. We need to reduce the pay of elected officials and agency heads by 10%. I took a voluntary one in the small stipend I get because I have to make a living in my real job. We can also increase co-pays for legislative and staff. We can change state employee pensions to defined contribution plans. And we can certainly eliminate some of the 213 state boards and commissions, which have a lot of duplication and lack some efficiency. Thank you.
Thank you. Now we go to the other side. Mr. Hammond?
Do I get 30 seconds?
After all four.
Being born and raised in Danbury with a family of 2 older sisters, and having a slight speech impediment, I just want to tell the audience that I often repeat myself because I thought that I wasn't listened to as a kid, and I sometimes sound strident, and that's part of the speech impediment that I had, which I'm not really strident. In 1991, I fought not to have the state income tax. I wrote letters to the editor. I did everything I could do not to have it, not for theoretical reasons, because my fear was what would happen has happened. And that is, we've given the state more power to raise monies. We went from number 18 in per capita to taxes for the government to number 5 between 1991 and 1992. We now rank number 3. So I'm upset with the state income tax, and I feel that that has caused this situation that we're in now. What would I do to make things better? It's been somewhat upsetting that what's been happening in Hartford is to raise money. They've raided the pension fund. They've taken the gas tax, which should be for the infrastructure of our state. They've raided the gas tax. They've taken the rainy day fund and used that. And as I mentioned, every fear that I had about the state income tax has come true. And the last point is, as a city planner in Westchester County, I used to work with the League of Women Voters in setting up meetings for master plans and so forth. And it's a real pleasure that the League is hosting this tonight. But also, I just want to thank Maureen Bartlett, Dave Goldenberg, and Charles Primiano. Without them, I wouldn't be here tonight. Thanks.
Thank you. Well, I primarily agree with Joseph. In 1991, when the state income tax was being considered, I was 29 years old, and I arranged to rent 2 buses from Ridgefield to bring up 70 Ridgefielders to attend the rally at the, on the grounds of the Capitol, which had between 60 and 80,000 people there. There's no surprise that we're in the situation we're in today. We predicted it, that we've got such huge structural holes in our deficit, which is the reason why I didn't go for it, as neither did Tony. We raided the rainy day fund, as Joseph mentioned. We borrowed $1 billion. We relied on stimulus money that we know is not going to be there in the future. We tried to correct that in the budget process. We tried to cut pay to elected officials. The Democrats didn't agree to that. We tried to end longevity pay. It was voted no. We tried to roll back spending to 2008 levels. The state wasn't that bad in 2008, but that was turned down. We tried to consolidate state agencies. We tried to eliminate travel reimbursement. As far as going forward, what can we do? I think the last thing we need to do is look at revenue. This isn't time to raise taxes. I think we need to create a new tier for for employees for pensions. The one we have now is extremely generous, and unfortunately we can't unilaterally change that. It's a contract. Now I can't read my own writing. I had something there. I had something very good, actually. We could change the pension, I think raise the retirement age of state employees. We can change the pension that's currently based on earned income. It should be on stated income. So in other words, your overtime doesn't count the last 3 years, where oftentimes they boost up. And one other thing, when I was a freshman, I was approached to help Boys and Girls Clubs get some money. There are 14 Boys and Girls Clubs in the state. I'm going to use a little extra time, because I think this is important at Germain. I was a freshman. They wanted a Republican to help get the support because there was strong Democratic support for it. And the idea was to, really, it was sold to me as kind of a 1 or 2 shot year boost to the Boys and Girls Clubs, the 14 of them in the state, to increase opportunity. Well, we were able to do that. We were successful in getting that in the budget. Much to my surprise, 4 years later, the Boys and Girls Clubs were still getting that money, even though it was meant to be in only 1 budget cycle. That's the problem with the state budget. Once something is in there, it's in there for a very long time. And there's really no reason for that. It ought to be reevaluated every year.
We now get to rebuttals. And again, we're going to go in the order in which the question was answered. So, Mr. Hartwell, do you want to say anything further?
I do. If you look back 2 years, just 2 years before the economy crashed, the state was not in trouble. And so what we need to do is to restart the economy in Fairfield County and have more taxpayers rather than more taxes. But a lot of the things that Mr. Fry just talked about are long-term solutions. We have a short-term problem as well. And we're going to have to look very carefully at what we do to cut out expenses immediately and or raise revenues or borrow more money. Those are really the 3 choices.
Yes, thank you. 2 years ago, in November, I told the Appropriations Committee chairwoman that we had a serious problem that was going to be protracted. She replied that it's only a 2-month blip. We were going to get out of this. There's no point to cutting back. In fact, the state has a spending problem, and it needs to stop spending and borrowing to the future of Connecticut. The people get it. They want us to stop. We should be listening.
The only rebuttal, the question that was asked is what specific items would we look at? Well, I'd begin at the very top, which is human services, which last year accounted for $6.4 billion as part of the budget, to look at that and see if every item is as cost effective as it can be.
Just real quickly, I think state employees oftentimes are demonized, and I certainly don't tend to ever do that, but we've got great state employees. I think they've got great ideas as to how we can solve the state budget problems. I actually tried to get a list of the state employees who live in Ridgefield so I can solicit their input, because I have gotten calls from state employees making suggestions, and the controller's office, believe it or not, wouldn't release the list to me, so I couldn't make that request to the state employees who are on the front line who might know. So I think we could use our state employees perhaps better and trying to find out how we can solve this problem.
All right, thank you all very much. This next question is an audience question, but it is in the nature of a follow-up. And it will go to Ms. Boucher first. What will you do to solve the problem of Connecticut's large pension gap?
Excellent question, because they're all connected. Did you know that Connecticut is number 2 in unfunded pension liability, $4,500 per person? One of 7 states whose pension fund is predicted to go bankrupt by 2020, and one of 8 states that lack funding for more than 1/3 of their pension. This is a serious problem. We have $25 billion for retiree health care and $9 billion for retiree pensions. Its total long-term pension liabilities is $61.7 billion. The practice of underfunding contributions to retirement accounts and the burgeoning cost to the taxpayer require fundamental change. In 2007, I co-sponsored a law safeguarding our teachers and required the state to make full annual contributions to the teacher retirement fund. We should be doing that with all of them. We should be doing that with all of them. It was just another way to not go where no one felt politically they could go, and that is state salaries, state health care benefits, and state very expensive pensions. Not laying anyone off, but just having them take a 2-year freeze, just like the rest of us have done it in private business. There are many ways now to deal with this issue. We can establish a defined contribution plan for new employees, just like I do in my private job. I pay every 2 weeks into a 401k plan. I could take that out of my take-home pay. That isn't happening at the state. We should also establish a rule when there's negative earnings and investments, there would be no cost of living adjustments. We could change the normal retirement age to 65. We could increase premium share on health care. You should know that one of my aides paid $40 copay for a pharmaceutical when he was a federal employee and only $8 as a state employee. Thank you.
Mr. Hartwell.
I don't think anybody here will say that the way that the pensions have been handled in the last few years at the state government level is the way we should be doing it. There's complete agreement on that. The question is how we move forward. And the problem here is that it goes back to a 1997 deal that Governor Rowland cut with the unions, a 20-year deal on health care and pensions. And all of the questions, all the suggestions that I'm hearing up here about changing that, good ideas, something we should be looking at, but they all have to be negotiated because the union's got a deal. It's a contract, you can't break it. So we can ask them to make changes, but we can't force them to make changes. And I think everybody has to understand that. There's no silver bullet here. There's no way we can walk in and say, well, we're going to change it now to a defined contribution plan because that's the way we'd like it to be. So we all have to be quite realistic here. And I think we also need to look at how both sides in the state government have contributed to the problem. So while we'll hear a lot tonight about the supermajority state legislature, we also need to look at the role of the governor in all of this. So for example, in addition to Governor Rowland doing the 20-year deal, we've also had 3 early retirement programs in the last few years. And what does that do? First of all, it takes a person who's close to retirement, gives them extra benefits, and asks them to leave. So we give them more than they're actually contracted to get. We let them go more. We let them go sooner, and so they immediately stop paying into the pension fund and they start drawing. And then a lot of them actually come back as consultants, making a lot of money while they're already on retirement. So it's an extraordinary system. We've done it 3 times. And just last year, Governor Rell negotiated a $100 million pension deferral with the state unions and promised them that she wouldn't cut any jobs if they would allow $100 million not to go into the pension fund. So the deals have been done on both sides. We need to understand that, and I'll come back to what I said at the beginning. This is a community. We have to work together to solve these problems, but they're not easily solved. They're very complex, and both sides in this particular case have contributed a lot to where we are.
Mr. Fry.
Well, I agree with 100% of what Tony Boucher said, and probably 90% of what Mr. Hartwell said. But Tony laid out the facts pretty well, and John stated that it's not just because we've had a supermajority of Democrats in the legislature. I think Governor Rowland, I was in the legislature in 1997 when that 20-year deal was made, but it certainly was a lousy one, it appears to us today. And I don't know, I can't speak to the circumstances, but we're living under those conditions today. By delaying our pension contributions, we're really facing a huge problem. And again, that was one of the reasons why I didn't support the budget. There were so many. But one of them was that we were delaying our pension contributions this past year. Waterbury got into a problem a few years ago because their pension fund ran out one bust. And they essentially had to go on a cash basis to pay their retirees. That's a situation that we could face in the year 2017. We have to work together with the state employer unions. We have to get them to the table and make them realize that we've got a problem here, that they've got to be a part of the solution. Nick Perna, at a forum, I believe, I'm sure it was sponsored by the League a few years ago, talked about the state of Connecticut and our pension and our state employees. And he talked about, and I've used this as several examples, and I've spoken to Nick about it several times. Years ago, people saw government jobs, especially those generations who lived through the Great Depression, because they were steady jobs. The pay maybe wasn't great, but the benefits were good. You had health care, you had good prescriptions, you had good pensions. Well, now the salaries are commensurate with the private sector. In fact, some cases are better. We had a professor at UConn who retired last year with a $158,000 pension that's going to go up every year. He's going to collect Social Security, continue with his Cadillac health insurance plan covered by the state. And I use that example. He wasn't in administration, he was just a professor. And I think that's something that the public has a hard time getting their arms around, as to why we should be paying so much when they're reaping such high benefits.
I feel all four of us are on the same page. The only two things I want to add is I believe statistically we have the highest pensions in the nation. And the second thing is whomever else is up in Hartford who was contributing to this should be fired.
Any rebuttal? Ms. Boucher?
Yes, thank you. The comment that you can't break a contract is not true. That contract was open for these concessions that just a little tweak saves $600 million. There are billions that can be saved with the right type of attitude and sitting down together, and a different culture in the House of Representatives where it's not just protecting one class of group people, but thinking about the state as a whole. Thank you.
Contracts are contracts. They can't be broken. You can ask people to renegotiate, and that's what we need to do. But we need to come in with an attitude that says we're working together, and we need to find a way through, rather than this is what you're going to do because I don't like the way it is now.
The next couple of questions are on health care. The first one is a bit long. New health care policies have gone into effect recently, including allowing qualified young adults to remain on their parents' or guardians' policy up to age 26, inability to exclude children with pre-existing conditions, and eliminating limits on how much insurers spend per person in a year and throughout the person's life. Major health insurers, including Aetna, Anthem Blue Cross Blue Shield Connecticut, Cigna, and United Health, have all stopped offering standalone policies for children in Connecticut to avoid the new federal mandates. Would you support legislation in Connecticut to prevent this practice? We're going to start on the House side, and it will go to Mr. Heyman first.
Yes, I would.
Can you repeat part of the question?
Major health insurers listed have all stopped offering standalone policies for children in Connecticut to avoid the new federal mandates. Would you support legislation in Connecticut to prevent this practice?
Yes, I would agree, I would. You know, many, especially in Hartford, think of Ridgefield as R-I-C-H field. But in reality, that's not the case. There's a lot of hurt here in Ridgefield. I think I'll have the opportunity to talk about that in a little bit as well. But as of a couple of years ago in Ridgefield, we had 70 children who are on the Husky healthcare plan. Husky is a program meant for children who are in families with basically poverty income. And again, I get calls, as Tony does and as any city legislator does, throughout the year, where people are facing various, some rather humorous issues, but some in a crisis situation. And there was one example was, while we have this Husky program, which is terrific, there were no dentists in the area that were providing dental care that was covered. You talk to the VNA who's in this building, they've got a well-child program where kids can get physicals for free. They're doing a whole lot more of those than they used to do before. So we have an issue. We think about it's an issue that pertains to maybe somewhere else in the country, maybe to Bridgeport or big cities, but it is an issue that we face here close to home. And nobody wants to see anyone uninsured, particularly children. So I agree.
Okay, thank you. Mr. Hartwell.
I actually hadn't heard that the insurance companies were cutting off young people, and I think that's terrible. So I don't know that the solution is one that needs to be legislated. Maybe if the insurance commissioner sits down and has a long talk with them, that might help things out. Every time we go and go through a legislative process to increase the load on the insurance companies, we find that the cost of insurance is going up. So we have to be very careful with those kinds of mandates. But if it comes down to the fact that children are not being covered because the insurance companies don't want to bother anymore, then if that's what happens, then yes, I would definitely support some kind of legislative remedy.
You're not going to find a lot of controversy between us on this issue, but it does bring out, this question brings out a very good point, and that is, be careful about unintended consequences with regards to the National Health Care Plan. There are so many questions, even our Department of Social Services is unsure right now about certain programs because the rules are not clear in a lot of it. There is no question that Connecticut has gone really far to try to make sure everyone is covered in the state. 18 and under has a Husky plan. You pay a premium based on the ability to pay. We have a charter oak plan for the 19 to 65-year-olds that I have a young man on it that has a pre-existing condition. It's very inexpensive, but it's also bare bones. 16 hospitals and 6,500 physicians. So you have to go a little further to get that. And as Mr. Hartwell has just stated, we have an overabundance of mandates in Connecticut, over 70 on every single insurance plan that's written, making it extremely high, making it difficult for employers to actually write one for the employees. Some of the things that are prescribed there don't even make sense. You can be over the age of 70 and still be eligible for fertility treatment. So a lot of people think that's a little bit silly, but you know, when you think of 70, and every year there's 10 more, and I get up on the Senate floor and say, you know, are you considering the ramifications of this? What is it costing when you do that? Remember, quality, affordable, and accessible don't mix. If you have high quality, it's going to cost you. And otherwise, you will have limit access, and you will limit quality.
Thank you.
When you do that, remember, quality, affordable, and accessible don't mix. If you have full access and high quality, it's going to cost you. And otherwise, you will have limit access, and you will limit quality.
Thank you. Rebuttal. Anything further, Mr. Henry?
The only rebuttal is I take issue about people being over 70 taking fertility pills.
The next question is also on health insurance, or health care, I should say. Insurers have begun seeking premium increases of 20% or more for some plans, saying that new federal mandates will raise costs. Some critics say that the increases are not warranted. How do you propose to slow the current unsustainable growth in health care insurance costs in Connecticut? And this question goes to Mr. Fry first.
Thank you. Well, for my first 10 years in the legislature, I served on the Insurance and Real Estate Committee, and I thought given my real estate background, would be a pretty good fit, but in reality, probably less than 5% is real estate related and the rest is all insurance. Interestingly enough, over 30% of those insured in Connecticut aren't covered by the state of, they're not regulated by the state, they're covered by ERISA or federal plans. So we're kind of limited as to what we can do across the board. Most of the issues regarding the rate increases are on a federal level, not on the state level, so we're somewhat limited as to what we can do. I know that I've had several calls lately on big increases for long-term care insurance plans that people have. 20, 30, in one case 42% price increase. So we have to monitor that. Actually, I have to call into the insurance commissioner, I called him today, to find out what it is that he's talking about there. But insurance is a very, very tough problem. Tony mentioned, and maybe John as well, the mandates. You know, we have 70 mandates. When you talk about, you know, the required fertility trials that now are part of the plans covered by Connecticut, it doesn't make exceptions to just those who are within childbearing years. And it adds, I think that one particular mandate added $14 to every person's premium in the state of Connecticut. So they all have a cost, whether it's, you know, mammograms or, you know, wigs for chemo patients or prosthetics or eyeglasses or hearing aids. They're all good things. But I can't tell you how many calls I get from people in their 50s in Ridgefield. The COBRAs run out, and you know what? They just want a catastrophic plan because they can cover their WellCare health insurance, health costs. And those are really going by the side because of all the requirements that we have here in Connecticut.
You know, an issue like this has to be studied thoroughly with all the ramifications both ways before any kind of decision can be made. And I feel that often we enact mandates and laws without the full ramifications being totally analyzed. My background is in city planning, and that's what I was taught at graduate school, is to take a problem and really look at the entire thing, not politically, but factually, and to try to get some idea, become educated as well as you can to know what the consequences and the ramifications are going to be. And in answering that question, that would be my answer as the first step.
The issue of cost and what drives insurance premiums up, there are many, many variables in that. Something that hasn't been mentioned though yet is actually the cost of operating a business, a hospital, a doctor's office, the fact that they do have to pay for their overhead, their building, their labor. We have one of the highest labor costs in the country. They have benefits that they have to pay as well. There's also the cost of medical malpractice insurance premiums, which is some of the highest in the state of Connecticut. We've attempted many times to try to reform it in Connecticut because we're higher than most other states because of various rules and regulations that have been put in place that unfairly actually target doctors. There are so many other costs associated with it that play into some of that extremely rising premium in addition to the many mandates that we just talked about as well. Cost of energy, one of the highest in the country, is in Connecticut. I will tell you though, the good news was that being for the first time on the Finance Committee, I was able to stop a new hospital tax, which again, taxes get passed on to not just the consumer, but to that healthcare plan as well. So as I said, there's many variables that play into that. And again, one doctor's office told me that he was telling his employees that they were going to be assessed $750 a year more because of the new national health care plan, which was a shock both to the doctor and the employees.
We all know that last year there was a new health care plan passed at the federal level, and we actually don't know to this day how that's going to work out. There are new regulations that are coming online. Everybody's waiting to see how that's going to happen. We need at the state level to integrate those with the Husky program, with the Charter Oak program, with the new Sustanet program that's been passed. So there's a lot of work that needs to be done. It is extraordinarily complex. I think everybody knows that healthcare as a whole is somewhere around 1/6 of the economy of the entire country. So there are no easy answers here, and I can't tell you exactly how the things are going to be integrated, but I do know that there's going to be a major effort within the legislature over the next several years as these regulations come out, and as probably Congress continues to tinker with it around the edges to get everything right. But there is a plan here in Connecticut that was passed by the legislature and vetoed by the governor, and I wish it had in fact gone into effect. It's called the Healthcare Pooling Bill, and it said, let's allow municipalities like Ridgefield to buy into the state healthcare program if they wish. And let's allow private individuals to buy into the state healthcare program if they wish, because the larger the pool in insurance, the lower the cost, because you get to spread the risk across a greater number of people or a greater number of municipalities. So rather than having Ridgefield go out and independently bid or have someone bid for their insurance product and Wilton do the same and Westport do the same, they said, let's just allow them to go under the state. This bill was passed, vetoed by the governor. There weren't enough votes, unfortunately, to override the veto. So, in fact, I believe Ridgefield lost out on hundreds of thousands of dollars of savings every year, which could have reduced property taxes. So there, I think, is a very easy way for us to save money.
Okay, for rebuttal, anything, Mr. Fry?
Just real briefly, as a follow-up to what Mr. Hartwell commented on the program that the governor vetoed, we have it's either two or three health insurance companies that cover the state, and they would have been asked to reopen their contracts to allow the municipalities to bid in. And there was an unknown cost. One insurer said they would withdraw from the state contract because of the cost. They wouldn't be able to honor the low cost, the savings that we were going to realize. So the problem is that there would have been a cost to the state that at the time was unknown. I think the governor touched on that in her veto message.
On this side,
Thank you. The primary reason that the governor vetoed this bill is that it was going to cost the state an exorbitant amount of money. I think we just reviewed the fact that we have high structural costs, huge benefits, 70% higher than the national average, and to roll out that plan across the state was going to cost not only the state more money, but it would cost individual towns that I talked to as well.
Mr. Fry said it was unknown. Ms. Boucher says it was exorbitant. I'd like to know where she gets the number, because she didn't give us a number, she just said exorbitant. There may have been a little more cost to the state, but no one knew. There would definitely have been savings to the towns. There were studies done. It was shown. It was very clear.
okay, thank you. The next question is going to go to Mr. Hartwell first, and it is, would you favor any additional state funding to prevent bullying in schools? Why or why not?
The media's been full recently of stories about bullying and tragic consequences, especially for young people who think they may be gay or lesbian or not really sure what their sexual orientation is. And this is just heart-wrenching to see a 13 or 14-year-old person kill themselves. I don't know that legislation is going to be the key. We need to establish safe schools. We need to have administrators and teachers always always thinking about these things, on guard for this kind of thing. But my wife has been a teacher and a school administrator all of her career. We've been married for 32 years. And I know how dedicated teachers and administrators are today. That's why they work in schools, because they love children and they want to see them do well. So I'm not sure where we go with this. If more training is going to do it, then let's get that training. It couldn't possibly cost as much money as what we see, the heartbreak for the families that are suffering from this.
The education and well-being of our students is really, and educational excellence was the very reason that I even put my toe in the political arena from day one on our local Board of Education, later on as an appointment to the State Board of Education, and currently on the Education Committee of the Legislature. I have to tell you that the bullying law was something we worked on in the Education Committee of the Legislature. I think we were one of the primary states, the first states that actually put something in statute to call attention to it, to have school systems pay attention to it. The whole issue of non-discrimination for sexual orientation was something I championed early on. And the implementation of it raises a lot of questions. It also raises a lot of legal questions for the school system itself. To what degree are they responsible for the bullying? To what degree are parents or students or the teacher responsible for it? As you can see from what just happened, we all have a shared responsibility in this area. And it's unfortunate that this issue occurred, but yet the public attention, the national attention being brought on it, and hopefully the conversations at the board level and the policy-making levels locally will readdress this and reinvigorate themselves into making sure that this doesn't occur in your school, to provide a safe environment. It's nearly impossible to take out all risk, as we as parents know and grandparents know, but it's certainly something we should pay attention to. As far as the cost associated with it, if it involves more training, it is already in the health curriculum, and it's something that we maybe could pursue and discuss. I'm sure it'll be brought up next year for whoever does get elected in November, and if it is I will continue always to be on the education committee.
What took place was a tragedy, which we all agree with. I'm uncomfortable with the state going in, trying to solve this. I would think it's more a local issue, certainly a family issue. But I'm uncomfortable with the state. Thanks.
Yeah, I'm pretty much in agreement. We did a law we passed a couple years ago regarding bullying, and there was a woman who, not a lobbyist, but she was lobbying legislators, whose son was a victim of bullying, and it was kind of the impetus of the action that we took. She spent an awful lot of time in the legislature, the Capitol, and her story was very compelling with regard to her son, who also did attend a few sessions. I agree with Joseph who said it, that it gets back to the family, gets to the schools. I'm not sure, look, everyone's against bullying. There's a program on the news tonight I caught that said there's a national study that apparently was just released today that the victims of bullying tend to be those who don't fit in, whether they're gay or lesbian or fat kids or little kids or short kids or kids who have other handicaps. So we need to be able to look out for that. We obviously looking for a zero tolerance for bullying. I'm not sure the question was about state funding. State funding is going to be very, very, very difficult, especially in new programs going forward. I'm not sure this one requires state funding, though. I'm confident that our local boards of education can address this properly and deal with the problem locally.
Mr. Hartwell, any rebuttal?
John raises a good point about the fact that there's not any state funding. We talked earlier about the $3.3 billion gap that's coming up next year. That pretty much guarantees that new programs are not going to be on the table because we're going to be cutting away from programs that already exist. That's where the pain comes in. So finding new money, very difficult at the state level, will probably come down to the town level if anybody wants it.
At this point, can I just see from the timers how much time has elapsed out of the box for the various candidates? All right. All right, so we're good to go. Okay, thank you. All right. This is another question dealing with education, but on a slightly different level. It's obviously an audience question. We are here for advanced placement government class, I guess. As high schoolers, yes. As high schoolers, college is very much on our minds. What is the state government doing, or I should say going to do, to aid higher education? And this question is going to go to Ms. Boucher first.
Excellent question. The state of Connecticut has some wonderful institutions of higher learning at the community college level, state university system, and also our state schools. One of the problems we have in Connecticut is that we have the second highest tuition in the country. The only other state with higher tuition in its public universities is Massachusetts. So it is very expensive to go to school here, and that is my concern, because the higher the tuition goes, the less access students have. Luckily, the community college system is now providing a 2-year program that is transferable, and the credits and the coursework is transferable to the state university system, so it's more accessible to it. Cost is a huge driver. We're very concerned about the kind of cost drivers, and there's more work to be done to look and see exactly what is happening there. We have a layer of bureaucracy that expands beyond the state university system. There is a board of higher education that has some fairly expensive staffing there that duplicates a lot of the efforts and positions at the state university system. So we can really look there in our next budget cycle to see if there's a way that we can create efficiencies and some consolidations as to reduce those costs, because it really comes out of your pocket. Too many students are having to upfront their education now. The debt that they have is astronomical. I have a daughter as well that has a $40,000 graduate school. She was lucky that we paid for our undergraduate, but not everyone is as fortunate to be able to do that. In fact, I had to pay and work my way through undergraduate and graduate school as well. So I do hear you. I think it's an excellent question, and I'm committed to looking at that problem if I should be fortunate enough to be reelected.
I have to agree with everything that Tony said. I've actually got a daughter who's got a higher debt load from graduate school. We were lucky enough to be able to pay for her to go to undergraduate. It's a terrible, terrible expense to start off with more debt than people used to spend on a house, and now you've got to just go to college, and we all know that the job market out there is not good. So unfortunately here in Connecticut, for the very first time, the state is now supplying less than half the money that it costs to run UConn. So tuition is costing students more than what the state is putting in. And that is so contrary to the public education commitment that this country has had since the very beginning. When we first had the Northwest Territories Act, and when the government was first started, they set aside land for public universities, for public education in each of the states that were then in the Northwest, Ohio, Northwest. So we have to get back to that, and we do have a strong community college system here. I actually have been a student at Norwalk Community College for the last couple of years, taking classes. I love it. Great kids there. Many of them are working full-time, some of them working part-time, some of them have children of their own, and they come to school because they realize how important this is. A lot of our children go away to school in communities like Wilton and Ridgefield and Westport. A lot of them go out of state and they don't come back. We have the highest outflow of 25 to 35-year-olds in the country. They don't come back. But we do have an extraordinary number of kids who stay here. And they're not all from Bridgeport or from Norwalk or from Stamford or from Hartford. A lot of them come from Westport and from Wilton and from Ridgefield and Reading. And they go to Norwalk Community College and they need a way up. And we have to make sure that that's affordable. And that's an educational cost that I think is very, very important. I'll just stay with this for a second here. The economy in this state has to come back. The drivers of an economy are education and transportation. Those are the two fundamental things that you have to have if we want to restart the economy here. So paying for education is something that we have to do. We have to find the money for it. And as we cut, and we're going to cut, as we cut, we're going to have to protect the drivers of the future, not just to take care of the current.
Thank you. A question to you guys. How many are considering in-state college, university? A couple. Well, one of the state study candidates made a good point, I think it was Mr. Hartwell, about the state's contribution on a yearly basis to the operating costs of UConn. And I don't know for certain it's going down. I don't know off the top of my head. But we've invested a significant amount in UConn and all of our state colleges and universities the last 16 years. We had UConn 2000, we had UConn 21st Century. So I first went to UConn probably 25 years ago, and there were buildings literally wrapped in blue plastic that were leaking, and the bricks were falling off. That's not the case anymore. UConn is a truly public university that we can all be proud of, as well as our state universities. I started going to WestConn years ago, and there was one building on the west side campus, Mill Plain Road, Lake Avenue. That's a full-size campus now. We've got a fine arts building, we've got the arts, more dorms, we've got the athletic building. But you know what? Now that we fixed the infrastructure of all of our state universities and colleges, we need to get back to the basics in the classroom. And I've spoken to professors about that, some of them in Ridgefield. So look, you know what, the buildings are in fine shape now. Now we need to reinvest in the classroom. And certainly, Tony mentioned the cost of tuition. That's really a driver, and they've gone up. In the last 10 years, an article in the Hartford Courant last week, in the last 10 years, the cost of personnel at UConn has gone up 297%. That's not necessarily well spent. I'm not sure we're getting 297% better from our professors and our faculty. So we need to watch that. But there are things we can do. We definitely want you to stay in Connecticut. Not only we want you to go to these state universities, we want you to stay here when you graduate. UConn has changed. Let me just finalize on this. Last year, UConn accepted 400 valedictorian students. That shows you the difference. Before, it was oftentimes a safety school. I can tell you how many calls I get from parents who say, look, what can you do to help get my kid in? He didn't get in an early acceptance. It's changed. It's a much more competitive school than it was. But it's time we need to reinvest in the academics.
John Hartwell, I thought, brought up a very good point, that an excellent education system is part of the entire package, which makes Connecticut hopefully a competitive state or not a competitive state. When you look at education, if you look at our infrastructure, that's the roads and so forth, which I feel are in somewhat disrepair. If you look at our electric rates, one of the highest in the nation, these are the items that will make Connecticut either attractive or not attractive. It's not any one item, it's the whole package. And I'm very concerned with what's happening with these various elements. Again, it was bothersome that the Hartford took the gas tax, which is the 4th highest in the nation, and have been using that for the general fund. I'm bothered about the electric rates, which I don't know who to blame for that one. But we have to begin making Connecticut an attractive, vital state again, and we were, in order to bring industry back and commerce back. This is part of the whole package. And just to add, my younger daughter just paid off her student loan, I think of $50,000, but she's been out of school for 10 years. Why am I saying that? Oh, to counter these two people.
Rebuttal, Ms. Boucher?
Very briefly, Connecticut ranks about 48 in business costs and 45th in cost of living, but it goes up to 35 in the country. This was a CNBC survey because of its education and its quality of life. So it's an economic driver. And one of the things I am concerned about that we should pay attention to, and that is our scholarship monies and grants that we do for independent colleges and public colleges. That's a fund that unfortunately has been cut over the years. We need to bring that back up to provide some income for you guys to help you get in and to be able to pay for it.
Not rebuttal, just to add a little bit. I've been working with people in Lower Fairfield County on the idea of innovation, bringing new businesses to Fairfield County to help restart the economy. We have to have the community college system and the state college system and the university as well as tightly integrated as possible with the business activities of its surrounding areas so that the kids who go to school there can walk out and have jobs on day one. That's really very, very important. We can't continue to lose our young people to opportunities somewhere else. And it starts with education and it links in to the business community so that they have jobs.
All right, this next question will go to Mr. Heyman first. What is the most serious transportation issue in our region, and how would you propose to solve the problem and fund it? For instance, Are you in favor of the reinstatement of tolls on Connecticut highways? Against? All right, let me start again. What is the most serious transportation issue in the region, and how would you propose to solve the problem and fund it? For instance, are you in favor of the reinstatement of tolls on Connecticut highways, a gas tax increase, mass transit incentives, widening roads, other?
I feel the most serious problem we have in Ridgefield has been the way that Route 7 has been widened from 2 lanes to 4 lanes. I did a survey, a traffic survey, accident survey, before anything was done in the year 2000, and we discovered that there was an accident on Route 7 between Ridgefield and Danbury every 4 days, one with bodily injury every 14 days. When I was on the Board of Selectmen, I urged the board to pass a resolution to have the state put a median down the middle of Route 7, and the Board of Selectmen passed that resolution. I'm very concerned that the way Route 7 is being widened from a dangerous 2-lane road to a dangerous 4-lane road will incur many accidents and fatalities. I'm sorry the state didn't hear us. We spoke loud and clearly. This was in the planning stage for Route 7, and it's very bothersome to me that, as I mentioned, the state is taking an unsafe 2-lane road and making it into a 4-lane unsafe road. And the Board of Selectmen spoke, and we weren't listened to.
Well, let me talk about the widening of Route 7, because I know it's been a concern of Joseph's for a number of years. And he doesn't like the widening, and frankly, I consider it one of my proudest achievements. When I was first elected 12 years ago, obviously Route 7 was a problem. Traffic was backed up. It was pretty obvious to everybody. There were too many accidents on that road, too many fatalities. We were averaging 1.4 a year. Super 7 had been proposed in the late 1940s, early 1950s. So one of the first things I did was to find out what was going on with this road. It was going nowhere. And a widened road had been approved about 10 years previously. It had the input of the Board of Selectmen at the time. It was when Sue Manning was first elected that they negotiated the traffic light at Bennett's Farm Road, as an example. And I'm not sure, Joseph, it was you, but somebody raised the point about a median. And I thought that was a good idea. And so I had a meeting, and I almost think you were there, I'm not sure, maybe you weren't. But at Danbury City Hall, and I don't remember whether you were or not. But it was when Abe Morelli was first elected, so it was my first year in office. And we had DOT come down, and we met with the mayor of Danbury, and we said, look, what about a median? And DOT said we had planned for a widened 4-lane road, not a 2-lane road. We looked at widening from Danbury to Norwalk. There's no median plan for any of them. It doesn't meet the federal highway standards for median. But we talked about it. They hadn't taken enough property to make it 4 lanes. You have to factor in turning lanes. You have to factor in additional drainage in the middle of the road where the median is. There's a lot of other factors. Frankly, I'm not a traffic engineer. But they said if they were to reconsider it, it could delay the road at least 4 years. Mayor Eriquez, who lived off of, I always forget the name of the road. I don't know why I should. The road, it's the first road past. Stars Plain, thank you. Mayor Eriquez lived off of Star Plain. He said if it's going to delay the road 4 years, I'm not for it. I've seen too many fatalities right in that stretch. And I haven't had anybody, other than Joseph, raise these issues on the widening of Route 7. It's pretty clear that they've improved the sight lines, they've improved the curbs, there's traffic lights where appropriate. I just got a traffic light approved where Laurel Ridge is that we should see the next year. So it's evolving. But there had been nothing that had been done for years on Route 7 until I got there, and I'm very proud of it. I think when it's finally done, we haven't had a fatality there in the widened part. You notice the traffic bottleneck is gone. The incidences of road rage, gone. Yes, there's speeders on the road, but we've kept the speed limit the same as it was before, 45 miles an hour, and when you get into Ridgefield, it's 40. So while it may not be perfect, We could have stayed the way it was. The fact of the matter is, Super 7 wasn't going to happen, and it was the mayor of Danbury who put the veto on delaying the road and considering a median. I wasn't not in favor of a median, but it was going to delay the road 4 years. We were all in agreement. We all left that meeting saying it wasn't worth delaying. As far as tolls go, no, I'm not in favor of tolls, not this time. The toll proposals that we've seen are on the borders. Who travels the borders? People who live on the border. Who are the proponents of the tolls? People who live in Hamden and work in New Haven. Guess what? They're not going to pay a toll. And the only time I would consider a toll is if we are absolutely guaranteed that all the money raised from the tolls is going to go to transportation. It's the point that Joseph got to earlier about the transportation fund, and I agree. There's money from the gas tax that goes in the general fund that shouldn't. And it was something that they started in the late 1990s, saying, okay, you know what? The state troopers are on the highway, so they should be covered on the transportation special fund. That wasn't what it was meant for. It was meant for rail, highways, bridges, mass transit, everything else, and it's being misused. So until I'm guaranteed, on behalf of the taxpayers, that the money is going to be used strictly for roads and transportation and mass transit, I'm not going to vote for tolls. I'm not in favor of one if it's just on the borders. The state is constantly looking for increased revenue sources, and they're not looking at spending.
The question was the most important, is that right?
Yes, sir. Let me reread it.
Please.
Yeah. What is the most serious transportation issue in our region, and how would you propose to solve the problem and fund it? For instance, are you in favor of the reinstatement of tolls on Connecticut highways, a gas tax increase, mass transit incentive, widening roads, other?
Transportation is a huge issue, and I guess depending on where you live, you might rank one as being more important than the other. I actually happen to live within sight of I-95 and Metro North Rail line, and I sit on the Metro North Rail Commuter Council, where we deal with commuter problems, and we try to give help to the railroad and doing a better job of serving its customers. Mass transportation is such a key issue in Lower Fairfield County. As I said before, my wife is a school administrator, and when she hires a new teacher, she has to sit down and have the housing question conversation with them. Where are you going to live? Because they don't pay enough money for people to live in Westport, which is very expensive. So they have to go to someplace like Stratford or Bridgeport or Norwalk, which then means that they're on the road every morning commuting. And commuting on I-95 is a real horror show. And in fact, in the few years that I've seen this, the capacity on I-1, the capacity hasn't changed very much, but the traffic on I-95 is so heavy that even at 10 o'clock at night, you'll see heavy traffic. That which you would have seen years ago during the day is now almost 24 hours a day. The road is really full. And the rails are full. Now we're getting 300 new rail cars. Governor Rail led that effort. That was terrific. I applaud her for doing that. We're spending $2 million on 300 new cars. They're on their way. There are going to be some in revenue service by the end of this year. Governor Rail recently wanted to take an option on 80 more of those cars. The bonding commission balked at that, and so it hasn't happened yet. But we need to make those kinds of commitments. And at the same time, along that road, along that railroad, there's a 5-year wait in most of the stations to get a parking permit. So people want to use the railroad, but they can't, or if they can, they're going to have to pay a lot more to do it. There's lots of mass transit opportunities in Lower Fairfield County. And looking at how we fix this is, I think, the major economic development question that we have. In order for people to start businesses, you have to have a way for your customers to get to you. You have to have a way for your suppliers to get to you. So you need transportation, you need access, and right now we don't have it. So working on that's going to be an issue. I agree with John. If we are going to look at tolls, and I think we have to look at them, I think we have to consider them. There was a study done a year ago and it said that you could get, there's $1 billion on the table, it's a lot of money. But if we do, I would agree with you 100%, no tolls unless every dollar goes to support transportation. Not $1 will go anywhere else. And believe me, we have the need for all of that money to fix the bridges that we have, to fix the roads that we have, and perhaps to widen I-95, which I really want to do, but when I look at it, I think there may be no alternative. These are very difficult questions, but when you make that kind of commitment, the infrastructure that you build is good for 50 years, 75 years. That railroad we're running right now was built over 100 years ago. We still use the right-of-way, we still use those bridges, we have to maintain them and keep them up. But that's what happens when you make that kind of investment. It's not just here for today, it's here for a long time to come. It's absolutely critical.
Transportation improvements are, as was just said, critical to Connecticut's economic development. Commute time is probably one of the top considerations that businesses and people look when they decide where they're going to locate. The benefit to our district in winning this seat has been my appointment as the new leader of the Transportation Committee that has been previously dominated strictly by folks from Hartford. And after years of work to focus the state and the DOT on our congested corridor and the need for mass transit improvements, I was able to get some real results this last 2 years. Keeping the Danbury Rail Line open, replacing the Super 7 highway plan with a road widening, and repealing the statute that prevented us from utilizing the Super 7 land for greenway activities such as the now in operation design of the Norwalk River Trail pedestrian and bike project. And also, despite constant resistance, I can't tell you for how long, I secured the funding, $30 million, for the Danbury Rail Line signal system so we can increase capacity and train speed. I also assisted the governor and others in bringing those 300 new rail cars on the main line, and also a very difficult building of a maintenance yard. Train stations in our area are receiving much needed refurbishments, like plumbing and parking spaces and building refurbishments. At this point, and fortunately for the already beleaguered taxpayer, I successfully opposed the reintroduction of tolls after going to many public hearings. I can tell you all kinds of stories. In Danbury, 40% of the population is from New York. Just to save 2% on their sales tax, they would go away. So for all of this, we will continue to advocate in the future if I should get reelected. And in the long term, look at the major renovations to the train stations and the widening of accesses and entrances to 95, as well as taking a look at what's going on currently, which is a study on what to do with this corridor as we go forward. Last point was we got private funding, totally private funding, to refurbish every single rest stop in the state of Connecticut without one penny from the taxpayer. We're pretty proud of that.
Rebuttal. Mr. Heyman, anything further?
We're told that the safety of Route 7 was jeopardized because the mayor of Danbury wanted the road built immediately. And I feel that was a very poor decision on the state's part and our representatives' part to be listening to the mayor of Danbury dictate the safety requirements of the state road. A median statistically would have reduced accidents by about 50%. What I'm talking about, a good example of Route 7 would be what was built going to Four Corners north of Danbury, in which they separated the medians. But the fact that a mayor is going to dictate to the state that they should build an unsafe road, I find that a difficult decision, and I'm not appalled, but I'm disappointed, and all of this will suffer.
Well, it wasn't the mayor of Danbury who vetoed it. He expressed concern, didn't want the delay. But the fact of the matter is the road you referenced to in Brookfield is a continuation of the expressway. That would be like what would Super 7 would look like if it was built here. That's not what we're talking about between Ridgefield and Danbury. We're talking about a 2-lane road that went to 4 lanes. And according to the National Traffic Safety Highway Commission, as quoted by DOT, that section of the road, as section south, didn't warrant a median. I would just say back to the tolls. If we're going to do tolls, they would have to be throughout the state, not just on the borders. You know, we see when the way stations are open, which are on the borders, we see a tremendous amount of truck traffic going through Ridgefield, downtown Ridgefield, and Route 35. I can only imagine when the tolls are open, the increased traffic is going to put on our local roads. So I think it's something we need to strongly consider.
I would agree if we did tolls, we'd do them throughout the state, and we actually use it to control the traffic flow as well. I'd love to get the trucks off of I-95, for example, during rush hour, and we could easily do that with tolls that differentiate by time of day. It's done in other places. It's called congestion pricing. It's easy to do, but you actually have to have the equipment in place to do it. I wanted to point out, though, that what Tony said a moment ago, and we need you to think about this. She wants to continue supporting transportation and investing in it. I would agree with that 100%. But she also wants to cut spending, and she doesn't want to have revenue increases. And I ask you, where do you get the money if you don't have revenue? You have to have revenue to support this. There is no free lunch.
Cutting spending doesn't mean cutting programs. Cutting spending means to go after the largest cost driver, and if you reduce those, and you do some well without even laying people off, you can find the money.
Thank you all. Can I see the elapsed time again, please, from everybody? Thank you all. This next question is going to start with Mr. Fry. It's fairly long. Okay. Connecticut has some of the worst air quality in the country. We have passed mandatory limits on global warming pollution from power plants. What measures would you support to reduce carbon emissions from the transportation sector? For example, would you support stricter emissions for all vehicles, a low carbon fuel standard, a measure to prohibit the idling for more than 3 consecutive minutes of any motor vehicle, similar to the restrictions on school buses?
Well, this was the time I wish I served on the Environment Committee, which I don't. I have supported the idling ban on school buses. I think it's a step in the right direction, especially given the fact that the school buses are idling at times for lengthy periods of time throughout the schools where the kids are lining up. We put strict emission standards on our fossil fuel plants. Unfortunately, Connecticut is overly reliant on fossil fuel. We get very, very little of our energy through nuclear sources. What was the, I'm sorry.
I can read the whole question or just the options?
Yeah, the options.
The options. They offered options on stricter emission standards for all vehicles, low carbon fuel standard, measure to prohibit the idling for more than 3 consecutive minutes of any motor vehicle.
Okay. As far as the emissions on all vehicles, I support that. One thing I couldn't understand when I was first elected was, why is it only cars that have to go through emissions and not trucks? When you're driving up 84, which is the road I frequently go into Hartford, you see these black smoke coming out of these trucks. They're not regulated by the state, unfortunately. They're regulated by the federal government. I wish they were. It doesn't make sense to just do cars and not trucks. But unfortunately, we don't have the ability to do that. One thing to keep in mind is that, while our air quality is poor on frankly too many summer days, it's more a result of what's blowing over us from the west. So what we need to do really is have the federal government look at what all the states are doing. So the air quality coming to us from the Midwest and elsewhere is blowing over Fairfield County is better quality than it is today.
I'm going to put my money where my mouth is. I happen to drive a Prius, and I like riding a bike. Okay, so I'm doing my little share on this thing. This is more a regional problem, I feel. The state boundaries don't stop environmental dangers coming into our state or not. The federal government has increased the efficiency of cars over the next years. They've raised the standards. So that's it.
On this side, Ms. Boucher.
The air that we breathe and the water that we drink are some of the two most important to both plant health animal health and human health. So it's been a huge priority in my view. I'm driving a Honda Fit that gets 40 miles per gallon. We have John Papa pushing electric cars, which we took a good drive around one of our towns recently. That movement is starting to take hold. But even when it wasn't as popular, it was something I felt very passionate about, and was the deciding vote, the one deciding vote in shutting down our City 6 power plants. I guess for that reason, for the fact that I push mass transit so hard, is the reason that the League of Conservation Voters has endorsed my race, as well as designated me as an environmental champion for 2009.
I agree with what John said a moment ago, is that a lot of the problem is drifting in from the west, from power plants in the Middle West that are filthy, and Attorney General Blumenthal worked very hard with other states to stop this. It's really a federal problem. It's one that has to be addressed at the national level, and I think that if you want to support someone who's going to work on that, work on regulation at the federal level, that you look at Mr. Blumenthal as your next senator, because he'll definitely be out there working very hard for us. Here in the state, wherever we can put incentives in place for people to change their behavior, I think we should be looking at that. Any economist will tell you that incentives work. So we need to target incentives to help people. So Joseph has got a Prius. Maybe we should tax Priuses differently than we do a car like mine, which is not as nearly fuel efficient as his. We need to look at that to change individual behavior, and we need to do it in a very smart way. But the overall problem is going to be a federal one, and we should be supporting those at the federal government level who are willing to work hard on it.
Mr. Fry, anything further? Right, Mr. Neighbor, anything further? Ms. Michelle? All right, this next question goes to Mr. Hartwell first. Would you favor any changes in the state's capital punishment law? If so, which?
Capital punishment is one of those very difficult moral questions. Does the state have the right to take the life of another human being? And at the moment in this state, the answer is yes. And we had last year, 2 years ago, I guess now, the horrible crime in Cheshire where the woman and her daughters were killed. And one of the two men was just convicted a couple of days ago. And I assume that he's going to get the death penalty. I myself am not a proponent of the death penalty. I understand people who are. It's a difficult choice. I would rather us not have it. I would rather have life in prison without the possibility of parole. But if the law is the law, and if this gentleman is convicted, as he has been, and he's sentenced to death, then as a member of the community who says, I can't have everything my way, then yes, I'll support whatever the jury does, what the judge does, what the legal system does. But I think I wouldn't set up a system that had the death penalty in it. But as I say, I understand people who do, who believe in it, and I think there are arguments on both sides. It's a very difficult question.
I, the governor, and over 60% of Connecticut residents favor the death penalty, both as a means of punishment for extremely violent crimes such as the deliberate rape, murder, and the live burning of Dr. Pettit's family, one as young as 11 years old, and as a deterrent to other premeditated murders such as organized crime and the killing of our police officers. You should know that it's rarely used in Connecticut, maybe once in every 45 years, but it probably should be used in the case above. Just so that you know, there are automatic bars to the death penalty in Connecticut, and that's why it is rarely used. The 5 factors are if the person was under 18 years of age at the time of the crime, they were mentally retarded at the time of the crime, their mental capacity or ability to conform his conduct to the requirements of the law was significantly impaired at the time of the crime, but not so impaired as to constitute a defense. He was guilty of a capital felony only as an accessory and had relatively minor participation, and he could not reasonably have foreseen that his conduct in the course of committing the crime that he was convicted of would cause someone's death.
the taking of a life, I'll back up. In 1965, I was in Vietnam and up in Tuiwa, and for the first time I saw dead soldiers, which was a devastating experience for me. And the idea of killing somebody for whatever cause I find difficult, but from a pragmatic point of view, certain states, Texas, has many executions, and yet it's done little or nothing as far as the crime rate of Texas. And those states that have or don't have it, studies have shown it doesn't make that much difference, number one. Number two, from a cost benefit, I'm told that if someone is convicted for execution, it might cost more with the appeals than if they were in prison for life. So from a cost benefit, I question if this would be a good thing.
I believe in the times I've been serving in the House, we voted on capital death penalty 3 times. And the first 2 times, if that was 2001, the legislature agreed to keep the death penalty. Last year, for the first time, the legislature voted to do away with it. And it was vetoed by the governor, and I think appropriately so. There are certain crimes that are just so heinous that I think the death penalty is appropriate. Let me just preface by saying it ought to be very rare. I'm not looking for the death penalty to be carried out in Connecticut like it is in Texas or Oklahoma. There should be absolutely no question. So whether the person confesses, or there are witnesses, or there's DNA evidence, I think those are the key factors. I don't know how, and so we voted on this, but the first 2 votes were before the Pettit case. And I can't tell you how many people have come up to me who were opposed to the death penalty, but whose mind has been changed given the case that we've been following in the news of late. Dr. Pettit, not to get personal about it, but he was very involved with the Connecticut Medical Society. He was an endocrinologist that has been practicing since the tragedy. And he would testify often before the Insurance and Real Estate Committee, so I got to know him just a little bit. I've only spoken to him once after. But what occurred there, and I'm not going to touch on details because they're disgusting. And I was at the U.S. Senate debate the other night, and both Linda McMahon and the Attorney General Blumenthal both support the death penalty. It is, I believe, appropriate in certain situations, this certainly being one of them.
Completely different subject. And the question goes to Ms. Boucher first. What unfunded state mandates would you work to eliminate? Which ones would you fund?
There are so many, I don't know where to begin. There are some that are really appropriate. I know that there's a lot of controversy about special education mandates, but if you have a special education child, you know how important services are for that child. But there are also some controversial ones, and a couple of them that were enacted just a couple of years ago, at the time, the worst time, have been delayed at some point, but not removed. One of them is in-school suspension. It's highly controversial because of the cost involved with staffing and rooms in schools that may not have the additional funds for it. There are some that philosophically believe that the punishment should be that they are not allowed to be in school, and there are others that think that it's a better idea to keep students in a place where they can continue to learn and to be monitored, rather than in some places a reward for being able to be sent home. Another controversial mandate that was passed on our schools was the mandate to treat 16 and 17-year-old with very violent crimes as minors versus adults as they are now. The cost of that is not actually in the incarceration part, but it is in our local police departments and having to set up a different process, and it would be expensive for them to do. So they're still up for discussion. We don't know where they'll end up at the end of the day, if they'll finally be totally enacted or if they will be continued to be delayed or removed. But the question of unfunded mandates is a serious one. I do believe that we should not pass any further unfunded mandates unless there's 2/3 majority of the House and Senate, and there should also be a thorough review of any that are being considered. In fact, we should review some of them to see just exactly what costs would be to the municipality. And if the state can't pay for it, then they should reconsider whether they're being passed on, because it just raises everybody's taxes.
I certainly agree that unfunded mandates are a problem, and that they should be regularly reviewed for their reasonableness and need. And if they're not needed, they should be taken away. There's no doubt about that. The question obviously is how needed, how necessary is something. So take special education, for example. The entire education system, for example, is an unfunded mandate. You know, we have to educate our children, and we don't get very much money from the state to do it, especially in towns like Ridgefield and Westport. So where is the biggest problem here? And I think special education is clearly the area that cries out for us to take a look and say, what is it, what's going on here? The costs are skyrocketing. The number of children who are in special education grows exponentially. It now takes up some 10 or 11% of the children and 25, sometimes higher percent of the budgets of the school systems, and it's growing. The needs are intense, and when a student can't be taken care of in the local school, then the school is obligated, the school system is obligated to put them somewhere where they can, and the cost can run $250,000 a year per child. Huge amounts of money. Something that really is not sustainable. On the other hand, as Tony just said, if you're a parent with a special needs child, you want help for your children. And we have a history in this country of public education for all. So I believe that the state needs to step in special ed and look at taking it over, providing much more support than they do now. And I think we need to work at the state level to find much more effective ways of dealing with what is really a spiraling problem.
Well, I don't disagree much with what the other two have said. Unfunded mandates, we pass on to the towns, and they bear the costs, and we pay that through our property taxes. I would say in the last 2 years, Republicans 8 times offered proposals that would have either eliminated, reduced, or suspended unfunded mandates, and they were voted down each time. Furthermore, there was a proposal to empower the State Board of Education to make local decisions. And this one-size-fit-all approach rarely works. The in-school suspension issue came up because it was an issue in 3 towns out of 169. And yet they decided to put it on, force it on all of our towns. And my understanding is in Ridgefield, it cost me $100,000 per year. That's just one example. And I think those decisions are best left up to the local Board of Education. As far as funding new mandates, again, we talked about earlier, funding new programs for the next 2 to 4 years are going to be very, very difficult. What we need to do is to get rid of the unfunded mandates as many as we can. Special ed is a little bit different, although the state does categorize more students as special ed than they did previously. That results in an increased cost. We were successful a couple of years ago in lowering the threshold before a town or municipality is eligible for state reimbursement, so I think that was helpful. It was a step in the right direction, but generally speaking, I think, especially when it comes to education, those choices are best left at the local level and our local Board of Education. I've met numerous times with we've had several superintendents during my tenure and different Board of Education members that met with them on 4 or 5 occasions at least, saying, please, no more unfunded mandates. And so I hold true to that.
The next example we have is of the Ridgefield High School, which was originally built for 1,600 students. And over the years, the same high school, because of state mandates, its capacity was reduced to 1,300 students. And then Ridgefield had to expand it to the tune of $45 million to meet the added student body, even though the original building held 1,600 students. So one has to wonder about funded and non-funded mandates, that if the state is going to mandate something, they should take some financial responsibility. We do get $1.1 million for special education, and that's good. And I was a substitute teacher at the middle school and the high school a couple of years ago, and I was very impressed with the facilities and the care that our special ed students get. And part of that is through state funding.
Any rebuttal on that? Starting with Michelle.
Just so that you know, the Connecticut Conference of Municipalities lists 1,203 unfunded mandates in the state. One of the ones I would like to see removed is the prevailing wage requirement for our towns and cities. It costs us a great deal more for a school construction project or any project they do. And it should be at current market value of labor costs. And unfortunately, it drives up the cost precipitously.
All right, this may be the last question before the summations, and it will go to Mr. Heyman first. Zone pricing for gasoline causes us to pay much more in Ridgefield than in Danbury, sometimes as much as 30 cents more. Yes, sorry. Zone pricing for gasoline causes us to pay much more in Ridgefield than in Danbury, sometimes as much as 30 cents per gallon more. Are you in favor of abolishing zone pricing?
I'm against tinkering with the economy as much as we can. Individuals have the choice of either buying gas in Ridgefield, which is a little higher, or they can go down to the intersection of 7 and 35 where it's less money. In general, I'm for less government intervention, less government controls, and in this case, I would suggest doing nothing.
Well, that's a very good question, and I think we should do something and not do nothing. I don't think nothing has worked in this case. Even the Attorney General has supported doing away with zone pricing. Zone pricing is when a tanker truck delivers oil, picks up oil in New Haven, and brings it to the Irving gas station, or say the Shell gas station at Cobb's Hill. Then it brings the oil, the gasoline, to a Shell station in Danbury, and charges Ridgefield more because of our zip code. The delivery cost is based on the miles from the depot, that's not what zone pricing is all about. It's what they can get in different towns, and I think it's wrong. It's unfair to the people of Ridgefield. I've had this conversation many times, and this isn't a Republican or Democrat thing. This is more of a, I guess, what zip code you're in. The Fairfield County legislators in the bipartisan fashion have the last at least 6 or 7 years supported it. We couldn't get it out of the General Law Committee for a long time. We finally did, then we didn't get it passed further. But it's unfair. Zone pricing has nothing to do with the delivery of the fuel to the community. It's an additional fee based on that community's, where the community is located. It's unfair. You can talk to the gasoline dealers here in Ridgefield. You can talk to your neighbors. There's no reason why if you go to Fast Freddy's in Danbury, it's 35 cents less sometimes than it is in Ridgefield. When it comes off the same truck, the same day, the same driver, and everything else. So I do support banning the zone pricing.
I agree with Mr. Fry.
It's not as easy as it sounds. Did you know that you have zone pricing for milk? Remember, if you reduce the cost in Bridgeport or New Haven and Hartford, they increase the cost in Wilton, in Ridgefield, and Westport. And if they were to be mandated to have zone pricing, what do you think they would do? They're not going to cut costs, or they're not going to reduce their margin to make a go of it as a concern. They're going to just raise the prices in our inner cities.
All right, thank you. I'm going to dispense with rebuttal on this because we have now reached the point in which we should be doing closing. As we did for the questions where we tossed coins, we have also tossed coins for the order in which the closings will take place, so that we are going to start with the first closing by Mr. Fry.
Thank you. Well, first I want to thank the League for sponsoring this event, and thank you all for coming. I know there are so many things going on tonight in town. There are other things you could have been doing, especially probably the AP students who could have been doing some homework. So I want to thank you for joining us tonight. I'll be honest with you, I wasn't going to run for another term as state representative, and it took me longer to decide this year than ever before. It would have been very easy for me to step aside. There's going to be a bunch of new people in Hartford, and the representative from this district could have been one of them. But what concerns me is our future. We're looking at a $3.5 billion deficit for each of the next 2, perhaps 4 years. And I think my experience on the Finance Committee and being a member of the House the last 12 years will serve me well. In addition to the other things I can bring to the table, that's the one thing. Frankly, I'm a night person, but this keeps me up even more through the night. I think about this all the time. You know, being a legislator, it comes down to 3 things, as I kind of pointed in my mind. One is the legislation. We're only in session 8 of the 24 months of our term. And I'm proud of legislation that I've worked on, whether it be the do not call list, or tax freeze for seniors, or tax credits for volunteer firemen, or renewing the Safe Rides program. The list goes on. And you don't get anything past this environment without help from the Democrats. Require insurance companies to cover medically necessary formula, baby formula. They came from a Ridgefield resident. And then there's seeking funds for local organizations. I can drive up and down town and point to organizations, which by the way, none of them were an earmark. They were all competitively sought and approved. And third is constituent service. And that's probably the most heart-wrenching. I got 2 calls today from people in Ridgefield who lost their job and are facing how to pay their mortgages. I think you have 2 more minutes now, right? Up to 2 more minutes. Thank you. Okay, 3 minutes. You know, I get calls, very odd calls. You know, someone who's had problems registering a boat trailer, to someone's father who passed away in Europe and is trying to get their remains back. And so you kind of prioritize them. So I take every call with great seriousness. There's more and more this time. I said before about Ridgefield, RICH. There's a lot of people facing difficulty right now, whether it's health insurance or jobs or paying their mortgage. I look at our quality of life and things that I've been able to do to assist us there, whether it be working against the casino expansion back 11 years ago, to getting cardiac care, full cardiac care at Danbury Hospital. Both those I played, a lot of people's hands were involved in that, but I played an integral role in both. We can talk about widening Route 7 further. I'm more than happy to, Joseph, but I look at that with pride. Ballard Green and the expansion of the Prospect Ridge and the modernization of our housing stock in Ridgefield, $20 million. The only thing the town contributed was the property. I took that from concept to now we're just about completed. So I've enjoyed serving my neighbors. I never thought I'd be in this job 1 term, never mind this long. I have to tell you that every time I walk in the House chamber, I still have the shiver. It reminds me of when I visited there in 5th grade and I saw Liz Leonard's name on her seat way back then. It's been a privilege for me to represent it. It's not something that I've gone to my head. I'll just tell you one funny story. When I was first elected, I was invited to the governor's residence, and I called my mother, because I'm living in New Hampshire. I said, Mom, I couldn't, not a braggart, I don't want to tell anybody, but I want to tell somebody. I said, Mom, I had dinner when I was at the governor's residence. She goes, oh, that's good. I just tried a new pecan pie recipe for my husband. So I've kept that in my mind and to keep things in perspective. You know, I'm just like everybody else in town. I just sometimes get my calls returned more than others should, but sometimes don't. And I look forward to the opportunity to serve for another 2 years and ask for your support.
Mr. Hagan?
2 years ago, John Fry, towards the end of the campaign, had a big ad in the Ridgefield Press showing all the projects he brought to town, as he was mentioning tonight. And there was $5,000 to Roar and something for the senior center and so forth and so on. And I thought it was a very good ad, and I admired it, because it showed what John Fry is bringing to Ridgefield. And that's where I began my campaign. I asked myself, what are we getting from the state, and what are we giving to the state? And as a city planner, it took many, many phone calls to the state, talking to many different organizations, and I discovered that Ridgefield gets, according to what the state's telling me, $6.3 million a year. $6.3 million a year. The second question I asked was, how much are we giving to the state in both state income tax and state sales tax? And I've been going around door to door on my bike and walking to meet Ridgefielders, and I asked them the question, how much do you think we're getting, how much do you think we're giving to the state? And just one person guessed correctly. We're giving to the state about $90 million a year. So in essence, we're getting back 7 cents on the dollar. So we are not getting the bacon, we're getting the crumbs. The next question I asked myself was, how much do other towns get, like Ridgefield? I looked at Wilton, about the same population, a little wealthier. And if you take the percentage that Wilton gets back and apply it to Ridgefield, we would be getting back $2 million more. I took Simsbury, a very similar town as far as the economics and social makeup of the town. Simsbury, if we got the same back as Simsbury, we would be getting $4 million back. Newtown, $10 million back, which is $1,000 per family. So we are not getting the bacon from Hartford, we're getting the crumbs. Hartford's getting our bacon. I was at a function the other day and I mentioned to Rudy that, Rudy, you know, we get $6 million, but we give the state $90 million. Rudy was shocked. He says, where's the $6 million? Which I thought was funny. So that's a concern I have, and I think there's a misperception that we've been getting, bringing home the bacon, but really we're getting the crumbs. And if you think that we're giving the state $90 million, we give the town of Ridgefield in taxes about $100 million in taxes. And every penny that we spend, it goes to the Board of Finance, it goes to the school board, Board of Selectmen, every penny is accounted for. And yet when we give the $90 million to the state, it's not as transparent. And this is a big issue that I have. I'm very concerned about it. Thank you.
Since enacting a state income tax in 1991, as I mentioned earlier, Connecticut's population and job growth have remained flat. Yet the state government has grown by 149%. A business-unfriendly and pro-union culture, as well as pretty much anti-Fairfield County culture, dominates the legislature, and the resulting policies have made national headlines with the nation's highest combined per capita tax burden, made worse by a $1.4 billion tax and fee increase last year. One that the governor could not stop, nor the minority could not stop, because a 2/3 veto-proof majority in both the House and the Senate. Despite all the tax revenue, we also have the nation's highest per capita debt. It is no exaggeration to say that this election may be one of the most significant state elections in a generation. While families and businesses have tightened their belts, state government has actually increased spending, taxing, and borrowing even more than before. Not surprisingly, these policies of the supermajority have sent jobs and people fleeing the state. Your own economist, Nick Perna, has said that the state of Connecticut doesn't need to tighten its belt, it needs to go on a permanent diet. I have to agree. But I do believe that Connecticut can thrive again, because we did it over a decade ago when there was a politically balanced, pro-business General Assembly. We need to get people back to work by creating an environment where jobs can grow, families can prosper, and seniors can afford to stay in their homes. We can do it by electing those who will fight out against and control the uncontrollable spending, those with the courage to make the difficult decisions that will restore Connecticut jobs and its economy. I hope that in the last 2 years I've shown you that I have that courage. I strive to listen well to your concerns, respond quickly to your problems, and relentlessly pursue what is right for our community. Alongside your dedicated state rep, John Fry, please don't retire, Governor Rell, and my colleagues on both sides of the aisle, we fought and actually won many battles during one of the most difficult periods in our state. Your support of my efforts to stop the unbridled spending and borrowing from the future has been truly gratifying. It's an honor to serve the people of Ridgefield, a town that I've grown to love over the past 2 years, and a state that we all love, and a state that is worth fighting for. I hope I've earned your vote to keep up the fight to revitalize Connecticut and once again make it a place to grow business, raise a family, and to retire. Thank you very much.
I'd also like to say thank you to the League for holding this meeting, for everyone tonight for coming out. I know that you had a choice of what you wanted to do, and I appreciate your being here. I know we all do. As always, an election is a choice, and this year is no different. On November 2nd, you'll have an opportunity to vote for someone who represents the same old partisan game that's been fought for years, or send someone to Hartford who will take a fresh look at the problems and opportunities facing our state and work with people to solve problems rather than to score points. Connecticut faces a huge budget deficit, not because of some wild spending spree, but because our national economy collapsed. And we were hit harder than most. During the Bush bubble economy, when times were good, especially in financial services, and the bonuses were rolling in, our income and sales tax revenues produced a string of surpluses and a healthy rainy day fund. Now the nation is going through a period of readjustment, and we're feeling this especially in Fairfield County. Our economy will get healthy again, and already the signs of a recovery are appearing. Our job is to navigate through the bad times and lay the groundwork for a new, more diversified economy in Fairfield County and the state. Everyone knows we need to cut spending. The real question is how much. If we take my opponent's path and cut, slashing the budget by $3 billion plus, we'll add another 50,000 people to the unemployment rolls. And the toll won't just be felt by teachers and police and fire and other public service workers. It'll reach into the restaurants where these people no longer take their families to go to dinner, the dry cleaners that they no longer patronize, the local boutiques and flower shops. This will delay our recovery for years. We need to find a better way. Reorganize government to make it more efficient and effective. Eliminate tax loopholes that allow some to have a free ride while others pay for services that we all want and need. And limit borrowing to projects that invest in the future. At the end of the day, we're a community. Let's work together to solve our problems. I ask for your vote on November 2nd.
On behalf of the League and Playhouse, I want to thank the candidates for both the House and Senate. I want to thank the audience. Now, as you know, ladies and gentlemen, it's up to you. Vote November 2nd. Thank you.